Well, welcome all to another monthly webinar series in our IFM Certified Practitioner series. So I'm Dan Lucasey. I am a Director of Medical Education at IFM and usually have the pleasure of both introducing and listening to these monthly webinars. As is my custom, I want to give you just a little bit of an overview for those of you who are new to this webinar series. We now actually have almost 1,300 IFM certified practitioners. You will be updated on that Find a Practitioner database as IFM certified if you're new to that. We get, I don't know, about maybe, I know it's somewhere around 2 million hits in 2019. And so that's most of those are consumers looking for certified practitioners. And if you haven't already gotten a number of referrals from that, you probably will now if you're just new to this. There is quite a demand for functional medicine practitioners. So as you can see on your screen, you also get the updated program materials, the videos and audios of all of the APMs and AFMCPs. As I do generally, I encourage you to listen to the newer ones as they come out, or at least parts of them, because there's always new information that we're updating all of those programs with. There's also the practitioner implementation series that you get updated on. And then there are, of course, these monthly webinar series that we've now been doing for about 6 years. And those, which I'll talk about that in a minute, but I first want to encourage any of you to if you're interested, we are always soliciting topics for this webinar series. So please, if you have an interest, if you have a particular area of expertise you want to share, clinical conundrum, practice management, please send in your interest to IFMCP at ifm.org, just a brief proposal with the title and description. There is an honorarium attached to that if we accept it. So we're always looking for new and interesting topics. 2019, we had some wonderful presentations. Those included really talking about osteoarthritis with Dr. Musnick, talking about integrative functional cancer care with Dr. Ho. We had a wonderful presentation in early 2019 on olive oil, its history, and the differences in those oils from Dr. Lawson. As you can see, there's many very interesting, I think, useful and sometimes thought-provoking presentations that certified practitioners and others give us. So I encourage you to kind of look back and check those out. So for 2020, we're starting off with Dr. Georgia Tetlow. And Dr. Tetlow is a founder of the Philadelphia Integrative Medicine Clinic. She's been the founder and CEO of that clinic for about 11 years now. As she says, the vision is to integrate the best of conventional with evidence-based medicine, yet to be incorporated into conventional protocols. And really, she has done a wonderful job and will be speaking to us about the idea of honoring yourself. And she does a lot of mentoring with other clinicians and how they can change their practice into a functional medicine practice model and be successful not only financially, but internally as well. So, Georgia, it's wonderful to have you here, and I look forward to your presentation.
Thank you so much, Dan. And you and Institute for Functional Medicine have helped so many people to be healthier. I'm just so glad to be a part of it. The topic today, as Dan shared, is all about an evolving curriculum called Honor Self for healthcare providers. And our topic specifically today is how to transition to, maintain, and relax into your functional medicine practice. So Honor Self is an evolving curriculum that's intended to help us as healthcare providers to embody health on all levels, mind, body, and spirit. So just a little bit about me, and if anyone wanted to review this slide, there's more detail here. But I am a Tar Heel. I graduated from UNC Chapel Hill Med School. And something that's very important for me personally, and also as part of my patient care, I became a mindfulness instructor in 2008 when I was a resident at Thomas Jefferson. I was a certified yoga teacher in 1993, and being a teacher, clinician, mentor for other healthcare providers, it's a little bit like being a family member. It's ripe for personal growth, and I wanted to take the time to share what I've learned from my own experiences as a business owner and clinician today. So I have been mentoring healthcare providers since 2002, and I'd like to share as much as possible through this webinar so that it can be of service to whoever's listening. So this is a quotation that is something that I wrote to myself. It's a reminder. So I myself, I tend to give a lot to my patient care. I tend to give my all, every last drop. And I am learning to remember myself and also to put myself first. So this quote goes like this: my work is to discover personal ease, space and relaxation, mental wholeness, emotional safety, and joy in this life for myself as my main job so that I can then share it with others. A work in progress. So I'd like to share that our intention as a model clinic at Philadelphia Integrative Medicine is to set things up in such a way so that when you walk into the clinic, that you're entering a healing environment. And we want the fact that just entering affects you. Of course, we want that to deepen as you spend time and go through your appointment. But our goal is to create an experience of healing and of safety. And that is intended for our patients, for our own clinicians who are caring for you, and also for our visiting providers who come to us for mentoring. So clinicians do come to see us from all over the country to see how we run things, to see how we interact as clinicians on site, really to see how we practice. So the way I put together our agenda today was really, I wanted this to be as really as of service as much as possible. So I'm focusing first on what gets in the way of feeling and being well as a healthcare provider. So we'll be addressing and discussing obstacles, and these come from not just my own experience, but also from the mentoring that I've done over the years. Then we're going to explore a basic framework, and this comes from the three main things that I have found that have made the most difference for healthcare providers that come on site and that I mentor via phone, but also this comes from a group that I've led on a monthly basis for the last 6 years for healthcare providers. These three main areas that we'll address more in depth are emotional health, mindset, community, and connection. Then I'd like to share more about a blueprint that I've created, and this really is an evolution. The blueprint is a document where you can reference what is the transition that's occurring as we begin to practice in a new way. So naming the transition pieces and the differences between a conventional model of patient care and a functional medicine model. Then we name challenges, and then we'll be continuing the discussion about obstacles that we started. And I'd really like to share some solutions, and that's a big part of the blueprint. And where we head to in the blueprint is finally it's articulating what the potential experience can be. What does it feel like when we are more healthy and well as a healthcare provider? I'll also just reference a place to get resources. So we have an Honor Self Starter Kit, and we have a lot of free resources on the website. So I'll explain how to access those and what those are for your benefit. And finally, I'll have a chance to share about our on-site Honor Self retreats. So this is our capstone program. We've noticed that if you are ready to change and you really want to make changes and also proceed in the transition to really thriving as a functional medicine provider, that it means that we need to make some changes from the inside out. And those are really the sticking points and the obstacles to overcome so that we can really experience and enjoy the success personally and professionally. So retreats can be the experience that facilitate these lasting changes. So that is a source of support, and we're trying to find those resources to support the changes so we can make those do that personal evolution. So I'd like to dive in and get started with some of the obstacles and some of these personal issues. What I've come to learn, they're not just issues that are coming up as we proceed in the transition and then to maintenance phase and ongoing, but they really are some of the major obstacles. They are the obstacles to address. So as physicians, as providers, we can often figure out almost anything, logistically speaking. You know, we know how to get education and to follow through and to obtain our certifications and to maintain them. And it's the personal blocks that we can often need help with. So some of these that come up frequently with healthcare providers are really a self-doubt question. You know, can I do this? In addition, there might be concerns and worries about patients. Where are they going to come from? And are they going to be a right fit for this functional medicine model? Sometimes we're wondering if we're going to be able to maintain the respect that we become accustomed to. Will I maintain that respect for my colleagues as I transition, especially when they don't know as much about the validity and the evidence behind the functional medicine model? Some people are charging money and are in a cash-based model when they transition, and that can be quite uncomfortable, especially in the beginning if one has not done that before. And then there's questions about, will I make enough? Will I be able to sustain myself and my family when I make this transition? So additionally, I think we can all agree that our field is so rapidly evolving. So it's not just new tests and new ways of testing, it's new ways of thinking about the body. The fact that our physiology is actually all connected. It's not just organ systems that are broken down to understand, but we are a whole organism. There is a gut-brain axis. There is connections between the gut microbiome, the skin microbiome, and even the role of patients in their own healing is sort of, we're at the tip of the iceberg to understanding some of these factors. So staying abreast and keeping up to date with such a rapidly evolving field. In addition, it can be really challenging to manage patient contact when we start to have different type of contact and relationship with our patients. Care can be more intimate. And how do we communicate with patients between appointments so that it works for the patient, it works for the provider, and it works for the practice? It can be harder to stay on time. Sometimes our patients can become more complex. We can be managing more problems in a single visit. Educating patients takes time, and also if we're inspiring our patient and also connecting with them, it takes time to listen. Very frequently, I'll hear this over and over again in different ways from mentoring healthcare providers and say, really, am I enough? And does this model work? So more control. Sometimes when we have an option to design our schedule and design our length of visits and also to have more control over our professional life, sometimes emotional patterns that we've been living with can actually become more prominent. So this is something that comes up quite a bit. So self-care can be affected no matter what model you're working in, whether or not it's functional medicine or conventional medicine. But when you have a little bit more control, sometimes the emotional patterns can actually surface to an even higher degree. In addition, this is something I've talked about for years, and I call it fear of the dollar sign. fear of the dollar sign has to do with whether or not we feel that, and how comfortable do we feel with charging for an appointment if we're in a cash practice, for example. So am I enough? Is it enough? Have I given enough? And sometimes this is not more common than one might think, or this might be affecting you. Sometimes we feel the need to prove our worth in each appointment. And this is exhausting and can lead to extended appointment times and also to some painfully extended preparation time for visits. So while we have this beautiful opportunity to change our work, to practice a new medicine, at times it really can feel like a crisis. And we are making major changes at the level of identity, at the level of our financials and logistics, and we're asked to start anew. One of the things that we've worked over time to articulate is a framework. So if certain things are in place, providers tend to feel healthier, more well, happier, and tend to thrive more personally and professionally. So we like to start an explanation of this basic framework with the bottom left, where we see emotional health. We'll get into the details of that a little bit more. That has a little bit to do with self-awareness and our ability to maintain healthy boundaries. We'll talk a little bit about mindset and how important it is. That's the internal narrative. And then also community. So this is connection and community, our connection with ourselves, our ability to have a relationship with our own body, but also our connection to community and to colleagues. So first, just talking about emotional health. I'd like to share this image, which is by a colleague of mine, Shia Stone. So one thing that was part of my training as a resident and ongoing as a faculty member at Jefferson is that it's really important to openly acknowledge mistakes when they happen. But what I've come to know also is that it's equally important to release those mistakes and release the sense of guilt that we can sometimes feel when we are in practice. I've come to cultivate an attitude as much as possible, and this is what I talk to my mentoring providers about, seeing if we can embody an attitude of that mistakes can be gifts. And this can be especially hard if we feel that we have hurt someone as a result of our actions and even cause serious harm or even death to someone that we've been intentionally trying to care for. To talk a little bit more about emotional health, we take such good care of other people. Sometimes we're wondering if someone can take care of us. And the answer to that question is yes, someone can take care of you, and that is your job. That's my job. It's the first job. So one question we ask at times is, am I first? And also what comes up. Sometimes there's a real resistance and feeling like, no, I can't be first. But this is something that we explore regularly. Am I first? Acknowledging feelings. So feelings are happening anyway, whether or not we choose to acknowledge them, and they can inform us and give us some of the answers that we're looking for if we can listen and allow. So there's an opportunity to have the same body, the same job, the same challenges, the same circumstances, the same family situation, and the same personal patterns, but for some of these to shift so they can be experienced as more of a learning experience, and so that we can have more ease. And this is a result of learning to become more emotionally healthy. So we can learn to see the role that we have in creating our circumstances, and just feeling less of a victim and seeing more of our role is a great way to reduce overwhelm for healthcare providers. Mindset, just very simply, this is something where whether or not it's how we think when we first wake up in the morning or as we're traveling between patients or even in office appointments, sometimes we can have a mindset akin to, I have to get this done. That could be in contrast to, I am enough, or there is enough time. And this type of shift can make a huge difference when we intentionally cultivate a mindset. So that's something that we work on in our Honor Self program and how to do that. And additionally, connection to self, to others, to nature, and feeling more embodied, our connection to our body. It's been working through my the monthly group that I hold for integrative and functional professionals, that this model has evolved. So we'll get into more of the specifics when we talk about the blueprint. And really some magical things have happened when I've joined with others to in personal expression so that we can talk about what we care about. And that's something that we do each month. And it's really a very special gathering. So before we get into the blueprint, I wanted to share about some resources and where to find those on the website. So here is a link, this particular right in the center of the screen. If you go to our website, one of the tabs is for providers, so we've just updated that. So all of our programs are for folks who are starting out in functional medicine practice or considering starting, but they're also for seasoned practitioners such as yourself. And one reason we have this resource page is because we receive a lot of interest in visiting and shadowing and experiencing our model site. And there's a lot of established clinicians who would like to come and mentor with us and experience the clinic. And we can only have so many people come and shadow with us. So we like to offer resources, a lot of free resources. And we've also created a starter kit. So if you click on the providers tab, and you'll see our offerings, you'll see options here. And at the bottom, there's provider resources. And that's a great place to click. So let's talk about some of the things you might find there. And I'm going to give you some highlights and the essentials so I can give you as much as possible today. So let's talk a little bit about the blueprint that's been created. Again, this is the nuts and bolts. It's about the essentials of understanding the process that we're in as we make a transition from a conventional way of working and thinking to a functional medicine model. We are articulating the challenges, obstacles, and we've touched on some of those. Solutions, what can we do? What are the steps we can take so we can actually fully make this transition so we can really experience the potential of being ourselves in a more integrated and peaceful and present way, and where we can have the enjoyment. So a key thing, I'll just show you some themes that come up in the blueprint. What are the main points of the blueprint? And an especially helpful image, which I'm sharing here, we'll talk about this, is that when you are making a transition from conventional to functional medicine, and some of you have fully transitioned and some of you are still in transition, it's really important to straddle these two worlds for the least amount of time possible. So for yourself personally, if you have a conventional practice part-time and you also have a functional medicine practice part-time, it can be really challenging to straddle both. And so what we talk to mentoring clients about a lot is to, in a realistic way, the way that works for you financially and personally, but to keep this as short a time as possible for your own self-care and for the care of your family. And there's a couple of reasons for that. In addition, there's another main theme in the blueprint, and that is that you are being asked, I am being asked to take a leap, to not just make a professional change, but also a personal change. So how do we self-propel into a new way of practicing, into a new way of being? You know, what resources do I need to find and receive so that I can make this change, so that I can take this leap of faith and put my true desire into action? So identifying those resources and supporting you is a big reason we have our program. So this is a picture of the blueprint, and this is something where we actually have a lot of specifics on this sheet, so you can get this and access this through the starter kit on the website. So we talk about what's different in functional medicine compared to conventional, challenges, solutions, potential. And I want to share some highlights to this blueprint because you can't see it well. It's too small in this particular image. So I'd like to share some highlights. So one of the things that's different in terms of the new model and also what you're transitioning to, we're no longer just making recommendations and talking about different items, and our patient care is shifting to educating and inspiring our patients to change. And that means that we're going to need new skills in the new medicine. So that's a difference in the transition. In addition to that, one of the greatest reliefs that my mentees experience is that if they're able to orient to the new mindset, that what is actually happening in a functional medicine appointment and in this type of medicine is that the process or the relationship that we're having with the patient, their level of engagement, if this is no longer us doing it, it's no longer the provider on their own or the drug doing it or the procedure doing it or that expectation. Of course, drugs and procedures are essential for patient care, and especially in acute situations and ongoing. But the process is actually healing the patient. The relationship and the healing environment of the clinic is healing the patient. And this can relieve a huge burden and a huge amount of pressure on the provider if they're able to really shift in this mindset. In addition, the patient is healing themselves, a real shift. So what are some of the solutions that we talk about in the blueprint? So I'd like to go there for a period of time. This is a good place to use our time today. So we've talked about straddling a conventional and a functional medicine, having both clinics at the same time, to do that to the least amount of time possible, but also to be realistic. And one of the reasons for that is because in order for us to feel comfortable and to start to gain confidence in the model and in ourselves, we need to be in practice. So straddling two jobs for the least amount of time doesn't just reduce stress, it's also really important for gaining the momentum and the confidence so that the provider does not actually retreat back to a purely conventional model, which I have had a number of mentors do over the years. And I've noticed that this is an important obstacle, that if it's not addressed, this can cause that kind of retreat back to a conventional way of practice that is not informed by functional medicine. And the model is not set up to practice a functional medicine approach. Another thing that's very important as a solution is to learn to manage time in this new model. So that means managing your expectations, your patient's expectations, and expectations have shifted now that you're practicing functionally. So we talk a lot about the specifics of this. So of course, training is essential, and making sure that we're well trained is a big part of the solutions that we talk about in the blueprint. In addition, we are talking about the internal workings of the provider. So we've mentioned emotional health, mindset, the ability to have self-compassion and to be connected to our colleagues and to our community. So this is really the gather step that's in our model, our go-to-it model. And there's an opportunity for us to feel compassion and feel it towards ourselves, and to have a body-centered awareness throughout the day where we're turning towards self and also remembering ourselves, as opposed to being so externally and task-focused throughout the day. One of my favorite solutions, and something that I've come to experience more and more personally, which really brings me great joy in my practice and really relaxes me and de-stresses me as I'm practicing in the clinic throughout the day, is that I can see symptoms as clues now. They're not problems. So I love the clues because I'm gaining more and more confidence that I can understand them and where they come from. And it gives me the sense that I'm really appreciating the mystery. And in order to feel this approach more and more, it's the process of being in practice, taking the lead and gaining the confidence. So the potential for us as healthcare providers is to know our value and to eventually be able to get to a point where we have the right amount of work and that we're not in a state of constant overwhelm or having expectations that are really unrealistic about how much we're supposed to accomplish each day. Also, there's an opportunity to have a more healthy relationship with time rather than feeling that we're constantly struggling and working against time and that it is working against us, but that we can shift to having a more healthy relationship where time is working for us. And we actually have a handout in the starter kit that helps the provider to think about their week to address this relationship with time. What we found is it's not planning the day, it's not planning the month, it's looking at the week and what the patient care responsibilities are and the other roles that we have as a family member, as a citizen, and also putting in the key pieces that are important for honoring oneself and for self-care. We'll talk about that in a few moments. So in terms of specifics and resources, it's a good time to talk about that. Through this link, through our website, the For Providers link I just mentioned, there's past talks to access. And one thing that we do in the clinic every day is we meditate for 5 to 10 minutes at 8 a.m. So that's for all the staff, that's for all the practicing providers, that's for me. And we have a number of admin staff and also myself will guide these meditations, and we record them, and then we share them on the website so that if you need a 5 or 10 minute meditation, this is designed for the practitioner who is starting their day, who's beginning to prepare internally for a day of patient care by also referencing and remembering self, remembering our breath, and having a mindful series of moments. In addition, we have a lot of pocket guides available on the website, so you can go there and download these. These are some of the favorite ones that people like to read for the pocket guides. There's one on bioenergy medicine. That's a favorite. Breath work. How can we have creative outlets when we are practicing healthcare provider, and also about movement. So I also mentioned here that there is a 20-minute phone consultation, and the reason why I did that little effect and I had that sort of turn on its head is that I don't have enough time to have all of the 20-minute phone consultations that I would like to have. So that's also why we develop a starter kit, which you can do yourself. So we have a very small, very low price administrative fee just to be able to access the kit. And I wanted to talk about the resources that are in that really help people if you're not able to come on site or ask about coming on site, or if you're thinking about your next steps and you're advancing your transition, or you're coming up against a roadblock or an obstacle, what can you do for yourself? And if you're thinking about, for example, coming to a retreat and being on site, but you're not quite ready to do that, these are things that you can do now. And we want to make that as accessible as possible for you so that you can immediately have that support. So let's talk first about the assessment that we've created. So this is an assessment tool that gives you a chance to identify for yourself what are some of the things that for you would help you to feel more in balance. And these are things that are unique for your particular situation. These are things that you might know that you need for yourself, or habits. And we have a place on the handout for you to actually identify those. And we'll talk about that a little bit later. That's called the Tetlow 10. So this particular tool is an honor self-assessment. So this is something that's a single page you can go through, and we've taken a lot of time to identify these questions. So in a self-assessment, I spoke with Dr. Hurdley Paolini, PhD, for a number of sessions to get these questions right for healthcare providers. So she's out of Florida, and her whole work is as a psychologist, as a PhD, to work with healthcare providers in this continuum of self-care. And we have developed this instrument, and have had it for several years and have evolved it as well. This is a helpful assessment to see where you are. And the instructions for this are to identify the one essential area to address, and then really give it your all to address that area. Don't try and address more than one at a time. And we found that that's been most helpful for our clinicians. In addition to the assessment, we actually shared the blueprint grid. So the blueprint grid is, let's go through this a little bit quickly. It looks like this, and you'll see the specifics and actually can print it out, and it can be readable for you. As well, we've covered earlier today the well-being framework, which talked about those components of emotional health, mindset, and community. So we have a visual for that as part of the starter kit. And then this is also an important document in there, which is, if you think about the weekly schedule, we actually have a document where you can work with all of the different roles and where to fit in the first things first. So we help you to identify the things you might need, but also there's an opportunity to see where they fit in your weekly schedule. And we always recommend thinking about things in terms of the week. Finally, this is something that I was beginning to describe. I was getting a little ahead of myself. I wanted to explain what Tetlow 10 is. So a Tetlow 10 is you're identifying for yourself those 10 things that are actually on one side, there's a chance to look at things that you might need to do. These are habits on the left and a place for you to fill that in. So I will share with you in the question and answer, Dan, if you'd like to ask me what my 10 things are that I've realized that I need to do, we can talk about that. And there's another, which is not another section to complete yourself, which is not just things that I need to do in habits, it's attitudes to cultivate. And there's certain things that if I can think and cultivate this attitude of how I think about things in myself, that can make a huge difference in my quality of life. There's a place for that on a Tetlow 10. So I've shared the examples of the habits and the attitudes that I have identified to help me to stay centered and to also feel like I'm honoring myself as the center of my life. And that's obviously a work in progress. I do not do these things and cultivate these attitudes perfectly. And also they change over time. So that's an area we can also explore. One of the things that I wanted to make sure we have time for is sometimes we know we need to make a change and we're not able to do it. It could be a pattern of overwork. It could be a pattern of self-criticism or perfectionism, or a way that we work with time, or a way that we overwhelm ourselves with the amount that we ask ourselves to do. It can be any number of personal obstacles. And these retreats, an honor self retreat, is a way to help you feel connected to your community and to your own courage to see a way, and to see a way that you could take the steps to be able to make some of these changes. So this is a picture of our first Honor Self retreat. And this is from 2015. And there's 12 folks in this picture. And in addition, there's me. And now the size of our retreats has shifted so that this many people is about the staff for the retreat. This is no longer participants plus staff. This is actually how many people it takes to run a retreat. And retreats are labor intensive, and they are a little bit more complicated for us to set up and to administer. But what we have found is that this type of experience, which is deeper and more affecting, this is what's needed to help us really make the changes and move forward with our transition to fully being in functional medicine practice. These are biannual retreats. They take place west of Philadelphia, and we're also been invited at several other locations. So those are coming soon, including Western North Carolina. So what we do in our retreats is we are practicing be the change you want to see. So we gather and move and eat and listen to ourselves and to each other. We address why we overwork, and we also begin to recover from some of the consequences of that chronic overwork. And we receive the support we need so that we can make changes. These retreats are intended to be intensive, but also to be balanced. So you won't be surprised to hear that we have some health promoting activities that we do on the retreats. There's time for introspection and a lot of time for ways to be in community informally and in a structured way. And this curriculum for retreats has evolved and is continuing to evolve since we started in 2015. And we ask also that you are not on call for your retreat weekend experience so that you can participate fully. And we've just come to see that when we act like human beings, especially when healthcare providers come together and do that, we can begin to feel human again. And we can become what we practice. So we do so much every day. Our days can be so full. There may not be a lot of time to digest our experiences. And sometimes we're feeling bad, for example, working so hard, but did I do enough? Or could I have done that differently? Or what about that extra thing I should have said to that patient? Or should I have said and communicated in that way? Couldn't I have done it better or different? So this ongoing narrative of, am I doing enough for my patients? Or is it too self-indulgent for me to put myself first? Or why are things feeling so hard for me? The truth is that we can start to experience more and more that our cup is full. With time, what we've heard from our retreat participants and from our mentoring providers is that as we continue to know what to do in this new medicine, so as we continue to learn and to know how to help our patients, what tests to order, what to do with the test results, and to the best of our ability, we can begin to get to a place where as we do our job, it's not quite as hard, and we begin to experience that our own presence and our own choice for compassion are enough. And our patients need to feel safe and to feel hope and to not feel alone. We do this and create this and co-create this with our patients, but we also need to feel this too as providers. So if you're interested in an Honor Self retreat, the contact at our clinic is Michelle. She is our clinic manager. And you would contact her because these retreat slots, they fill quite quickly. The next available slots for an Honor Self retreat are in October in 2020, and we're just defining the date for that. So we're just about to finalize that, or we'll be finalizing that soon. So in summary, we've talked about Honor Self, and we've touched on a shared framework, foundations for feeling and being well, including touching on emotional health, mindset, and community. I've begun to share the essentials of an Honor Self blueprint that help us to see the transition that we're in and some of the solutions and the potential that we can be headed for. I've shared about resources and how to find them. And I've also shared something that's really most important to me, which is why you might want to consider coming on a retreat. And we want you to come on the retreats. And these are the hardest for us to coordinate, but these are what our providers get the most from. And this is what I get the most from as well. So sometimes the best way to move forward, to change and to feel a sense of community is to experience this environment and to be affected by it and really to take it in deeply. I'd like to thank a couple of my staff first. This is Alexa, my senior clinical liaison. On the left, this is Michelle, my clinic manager, and Denise, my executive patient coordinator. In addition, I'd like to thank my providers, Linda, Zoe, Rachel, and Jill, my business manager, and my personal clinical assistant, and my scribe, Kelly. I have clinical administrative assistants in the office, Joe, Christina, and Nicole, and everyone's contributed to this webinar. And I also have some consultants that help me to run my business who work on a part-time basis. So those include Rebecca Cohen and her modality, thepathttoheal.com, and my family, my colleagues, my friends. Wanted to say thank you for including me, and would be ready to transition to question and answer.
Well, thank you, Georgia. That was a wonderful presentation. I didn't actually realize you were a Tar Heel. I went to Duke University, so this creates a little bit of a little tension within me.
Well, if it were my brother speaking, it would be a great tension. He continues to live in Cary, North Carolina.
I'll overcome it. I'll overcome it. So a couple of things I wanted to follow up on. One, obviously, that you already suggested that I do, and I'll get to that. But the first is I kind of wanted to know how long, in terms of your evolution and transition from a conventional, or what kind of conventional practice you had to a functionally oriented practice. Tell me, or tell us a little bit about that.
That's a great question. And actually, that's something I'm looking forward to sharing more at the end of May. So my personal transition was I made a commitment that I didn't want to borrow money or to go into debt or take any loans. So I did have a period of time where I chose to be in conventional medical practice in a particularly lucrative way, to be able to support myself financially on a part-time basis so that I could begin to open my clinic in 2009. So I actually became certified as a wound care certified physician, so CWSP, and I worked in nursing homes and I provided wound care, and I traveled as far as western part of Pennsylvania. So I was based in Philadelphia, and I drove as far as Harrisburg some days, all the way over to the other part of the state. And I was an itinerant wound care physician caring for patients. I was a 1099 contractor for a company, and I had wonderful relationships with the nurses I worked with and with my patients. And I did that for several days a week as I began my own integrative clinic. And I worked outside of an office in a shared office setting, and there was just a room. There was no room for an assistant, so I had a virtual assistant and I had myself. I did my own vitals, I did my own checkout, and we've evolved since there. So since then, we've changed our location after several years, and I began to have more personal on-site help. And I can say also that having that transition where we're straddling both worlds of doing conventional care and functional, keeping that as short as possible was true for my own experience as well.
And just you told us a little bit about your current practice. So how many other clinicians do you have? Tell us a little bit about that. I'm just curious as well.
Mm-hmm. So we've had physicians in the clinic, MD/DO positions. So we have nurse practitioner, physician assistant, and then we also have a different level of care. I have my own scribe. So that has actually been a wonderful discovery in how I can also receive help and receive support. And we've often had to clarify with the patients that it's not taking away. When they know that there's an assistant or a clinical assistant in their appointment, sometimes they're concerned that they're going to be spending less time with the provider. But in the case of a scribe, it actually enables you to have an even better connection with your patient, and some of the documentation is facilitated. So that is an area of recent discovery, and I'm really pleased with that sort of innovation that we brought into the clinic. So we have both on-site staff and virtual staff. So I've continued to have a virtual assistant. We have an executive patient coordinator, Denise, who we only see once a year for our photographs and for our annual party, and to celebrate her anniversary with the clinic. And she is someone who coordinates all of our new patient appointments. So she's explaining who we are and what we do, and she stays in close touch with us even though she's not on site. She's just such a valuable team member that I didn't want to lose her, and she continues to just work very seamlessly with our on-site staff. We also have coordination with our business manager and our clinical manager, who are overseeing administrative staff and doing training as we incorporate new test kits. We probably turn over our test kits every 6 months, but we're doing that throughout the year. And that's an exciting way that supplements we have in the office and supplements that we have favorites on our online store, we like to stay abreast and to follow the thought leaders and to discuss those in our clinic. So we have a half an hour provider discussion of all the patients in the clinic every morning for half an hour right before meditation. So 7:30 to 8 we gather, and that's a way for us to also stay in touch with each other, to inform patient care, to get questions answered, and to also address sometimes the difficult things that can come up in patient care that are personal, where we're having difficulty communicating or maintaining a boundary, or someone is choosing to get their care over messaging and we need them to come in. So we help each other in terms of patient care and also on the personal level. And that's a little bit of how we structure our day. And we have a very specific way of having a number of appointments grouped together and then a break for the provider. And then we do that twice in the morning, twice in the afternoon, with always a time for lunch. And sometimes we'll bring lunch and provide lunch, and sometimes we'll have a potluck. And we have that time in the middle of the day to see each other and to spend time.
Yeah, that sounds good. I think one of the things that you've obviously discovered and I think I've certainly discovered both in positive and negative ways, is the people that you're working with in the clinic and the connection that you have can have a profound positive or sometimes a negative effect. And it sounds like you've really created a space with your providers and staff that really has a very positive connecting effect. So that sounds like part of what you've discovered about how to honor yourself. And you talked about, and you've talked with me before about having a scribe and being one of just a really, really useful thing. I've heard other clinicians talk about that. I'm just curious, are there a few other things that you found over the years, kind of putting you on the spot, but just that were really very important, maybe not breakthroughs, but important kind of pearls that you could share? I think having a scribe is actually one of them, and I appreciate you saying that. Anything else that comes to mind?
Well, one thing that I think I've learned over time is that when I'm interviewing a provider to join the practice, I'm looking for someone, there's certain basic fundamental things that have to do with how much experience they have. So those are decisions where sometimes I'll commit to a healthcare provider who doesn't have a lot of experience because they're simply such a good fit for us. And they're a good person to bring in and to mentor and to train while they're one of our own clinicians. And what makes someone a wonderful fit is also their understanding that what we're doing in our clinic is not just patient care, but we're also part of a larger change. And they're also doing a process where they are becoming healthier and they're engaging on basically some personal growth and some personal evolution where they're not just coming into work and seeing patients, checking in, checking out, but that they are engaging with we're part of a model clinic. We're part of a practice site, and we're part of training others and contributing to the evolution of a curriculum, which has to do with providers being healthy. And they're part of that. They're part of that discussion and contributing to that. And when they do research to see their patients, when they have a pearl, they share that in the morning during the provider meeting, and we have a chance to incorporate that in some of our documents. We have extensive educational resources and documents for our providers so that when we have a discussion, we can document that and reference it with keywords so that we are building on our discussion and we're referencing, we're sharing, and that our providers are really part of something larger. And that is really important to me when I'm interviewing someone for the clinic. And it's their attitude and how they think about themselves and what they want to be part of. And honoring that has really helped me build a team that I feel wonderful about. And we have everyone is included, and we have a different level of just participation in not just patient care, but it's in collegiality and communication and mutual learning.
Yeah, I think that's a great pearl. So you mentioned this Tetlow 10, and why don't you, as you suggested you would, give us a list of what you have put down of the kind of the things you need and the things to do and things to need. What have you found for yourself?
Well, I discovered as I was doing this, Stan, that first of all, I thought there was a little ring to it. You know, it's like the Tetlow 10. I thought that sounded good. So I thought, well, let me see if I can have 10. And as I was writing the list, what I realized was there were 5 things on the list that were habits, and there were 5 things on the list that were attitudes. They weren't things to do. They were sort of ways to think about myself or ways to think about my work or things. And so when I developed the worksheet for people to do as part of the starter kit, I said, think about 5 things that are habits for you, things that you need to remember to do or that help you to feel well when you do them. And then 5 attitudes. And it came from me trying to do it for myself. And then that's how the layout and the organization for the worksheet came. So the things that I have found for myself that help me to stay more centered and more in balance. The first thing is to go to bed and have a reasonable bedtime. And that identifying that has helped me, because then when I'm making decisions in the evening after a busy patient care day and I'm with my family and I'm doing things that I care about, I also remember to prioritize this thing because I've identified it. After that, the next item was exercise. So I put down exercising or dancing at least 3 times a week. And this can really get pushed out with other activities and commitments. And it helps me to keep it on that list, on the schedule, on the weekly schedule. Also, I put down as things to do, time for pleasure. So sometimes I'm very utilitarian and I do things if they make sense and if they're good for the business and they're good for the mentoring clients and they're good for the patients. But time for pleasure is really important. It's the enjoyment piece. It reminds me to prioritize those things on a weekly basis. The next thing I put down was community and connection. So prioritizing friends and colleagues. And I have a wonderful group I attend every month, which is, we call it the Seven Sisters group, where there's different healthcare providers of all different modalities. And we do potluck and share a meal, and that's just very regenerating. And the final thing on my habits list is a regular mind-body practice. So I have been a meditator since the early 90s, and sometimes I will fall off the wagon, and this helps me to stay. I do need some personal time, some quiet time every day, and that helps me. In terms of attitudes, very briefly, Dan, an attitude of gratitude, because sometimes I can be looking at things and thinking, oh, this could be better, this could be different, it could be related to me or my staff or to someone that I'm supporting, and to having an attitude of seeing what's right. Reminding myself to not rush and how I manage my time. And also, I can get distracted. Well, there's so many things to do and be involved in. I get quite excited. So I've reminded myself to, when I do a task, to try and stay focused on that and not get off-railed, and to see all the squirrels and to watch for the distractions. That helps me because I notice that pattern more. The last 2 things are to ask for help. Sometimes I think, oh, I could do this myself. It'll be faster. I watch that. I try and pay attention when I think like that, and try to train my staff and train my colleagues, my providers, so that they can do things for themselves and I don't need to do things as a system change, and to help me. And the final thing is to just remind myself to have an open heart. Sometimes it's really challenging to own your own business, and there's really tough things that come up in patient care. And there's a lot that goes on every day inside us, in our hearts, and to remind myself to have an open heart and to communicate my needs. So those are my Tetlow 10, Dan.
That's a great list. And do you do that on a weekly basis, or are you doing that on a yearly, like a resolution, or how are you using that?
That's a great question. So when we have it in the starter kit, and this is what we talk to people, and I actually did this again for this talk because we were making sure the handouts are right. So I probably do it, it could be once a quarter or a little bit more often that I do my 10 things. But when I am thinking about my weekly schedule, I'm not redoing this, but I'm referencing it, because I got to figure out what's important to me and what helps me. And I'm thinking about my week. I want to put these things in the week. So I'm going to be remembering about bedtime and exercise, and I'm going to be thinking about, oh, it's going to be 2 super long days right in a row. So when am I going to fit the exercise in that week, so that I can get at least 3 times in when I can be having that release, or dancing or exercise. So I'm using it on a weekly basis, but probably redefining it and revisiting it at least every quarter, but probably a little bit more often than that. So when I do a talk, I always revisit my Tetlow 10.
That's great. Yeah, the attitudes are basically revisiting those daily, and your your intentions and what you're thinking about. I think those are really important things to keep top of mind, so that you can continue to not get distracted.
Yeah.
Well, thank you, Georgia. That was a wonderful presentation. It was a nice discussion, and I'm sure that many people will access some of those, many of those wonderful free resources you have, and also some of the smaller payments, and then hopefully a number of people will take you up on trying to get into some of your retreats. It sounds like you have a wonderful model going there.
Thank you so much, Dan, and thank you for including me in your webinar series. I really enjoyed it.
Good.